This is Annapolis Week on MarylandReporter.com. I'm Len Lazarick, and with me today is Senator Thomas Mac Middleton of Charles County. He is the chairman of the Senate Finance Committee. Thanks for being here, Senator.
Pleasure.
And congratulations on your first Citizen Award. It's a major award that's handed out by the Senate to three people every year, and you and Senator Frosch got one.
I was very honored, very humbled.
The Senate Finance Committee has jurisdiction over all kinds of health insurance, auto insurance,
Banking,
all kinds of stuff like that,
labor,
utilities. But we want to talk today about federal health care reform. Tell us where Maryland stands on that and why it seems to be in a rush compared to other states.
Well, the federal legislation has many pieces to it. And we're working on the things that are most eminent now that we need to move forward. The federal law requires that we set up an exchange. And that's the biggest piece of the legislation this year, is setting up that exchange. If Maryland doesn't do it, if states don't do it, the federal government will come in and set up the exchange. So we have to do it.
And that has to be up by 2014?
Right. So we're rushing ahead because, health care for all kicks in 2014. You can't, the reason why you set up these exchanges is to sell the product through. And what they found in most states like Massachusetts and others, the exchange is where most of the people that need subsidies, that are entitled to subsidies, go to get their insurance.
So the exchange is to give access to health insurance to people who don't currently buy it.
It will become Maryland's Health Insurance Center, is what it will be.
And have you, insurance brokers, manufacturers have been concerned about what this exchange is going to do to them?
Yeah, they have a concern. The health insurance brokers are concerned that if this becomes a big governmental entity, that you will have government workers selling insurance as opposed to the infrastructure, the human infrastructure we have in place now, the insurance brokers. And there's nothing in this legislation that takes that away. Absolutely nothing. And the legislature is going to be very, very involved as we build this exchange. We're not finished with it yet. What we will end up this year will be a skeleton of an exchange that has enough authority to move forward to get grants that the federal health care bill provides in order to do the education, the outreach, setting up associations, those types of things that are available. This exchange will be able to draw down that money and start its work. And that's basically the authority that we're going to be given this exchange. Also the ability to go ahead and bring in the top-notch people that you're going to have to run this exchange.
But the legislature is going to continue to be involved in this implementation?
Absolutely. This is not something that's going to be finished this year. Hopefully we will have this finished by 2014. We'll have all the flesh on this skeleton that we're starting out with this year.
What about the argument that we're moving too fast, we ought to wait to see how these federal court cases are going to work out because people expect it to go to the Supreme Court? Is there any merit to do?
Well, what you're finding, even in cases, the states where there are lawsuits, they're moving ahead with the exchange. Mm-hmm. They are moving ahead. It's one of those things I don't think you can wait around until the Supreme Court decides this whole entire thing. Most states are moving forward with putting an exchange, and I think Maryland needs to do it, and I'm glad we are doing it.
Explain what are some of the issues that we were talking about earlier in terms of manufacturing in particular and some of the economic drawbacks of health insurance in Maryland.
Yeah, well, the big concern as far as when you look at, we've talked to manufacturers, we've talked to business people that have really highly paid professionals, and typically they provide health care benefits for them. Manufacturing is one of the big ones. One of the reasons why we're losing a lot of the manufacturing jobs is our corporate income tax, but also the cost of health care. What the federal government is still working on, they're going to come up with an essential benefits package that says that every insurance product that's sold has got to have these essential benefits into it. The 48-hour stay and certain things like that have got to be in there. Anything over and above that, it still remains, who's going to pay for that? Are we going to put it into the cost of rate, or is the exchange going to have to pay for that? So we've got to be very, very careful. We have at least 2 or 3 additional mandates on top of the 40-some that we already have in place before us this year.
Is there the potential for people to lose some of these mandates that they fought hard for?
Well,
in vitro fertilization is one.
in order to do it, the legislature will have to undo the mandates. We put them in place in statute, and if it's our decision because the cost of our product, it puts us at a competitive disadvantage with other states, and we have to reduce the benefits, we have to actively put a piece of legislation in and undo those mandates.
But
so that's why I'm very cautious as chairman of the committee to take on additional mandates this year, to perhaps 2 or 3 years down the road to have to undo them.
Mm-hmm. But those things are not going to happen this
No,
year.
the federal government still has, they're in the process now of meeting and public meetings and whatnot to decide what exactly has to be in that essential benefit package.
Well, thanks for being with us here today on,
Absolutely.
and this is Annapolis Week with MarylandReporter.com.